Hello, my friend. Welcome to your allergy test. My name is Dr. Amdia, and I understand that your primary care doctor referred you here today to have some allergies tested. Is that correct? Perfect. And have you ever had an allergy test before? No? Okay, well, you have nothing to worry about. I will explain how the whole test works before we get started, okay? Okay. So I am basically going to be taking some very common allergens like pollen, cat dander, shrimp, all that good stuff. I'm going to be taking those allergens and I'm going to be rubbing them on your skin. And we're going to see if you have a reaction, okay? Yeah. So I'm going to be using the skin on both of your forearms, if that's okay. Okay, perfect. And another important thing about testing allergies is we have to make sure that we are looking at the correct thing. So I am actually going to be drawing with a marker a grid on your arm so that we can differentiate where we put different allergens. Does that make sense? Okay, good. And I'm actually only going to be putting allergens on one side of your arm, and then the other side we're going to be doing what's called a control group or a placebo. So for example, if I have a Q-tip and I put an allergen on one side of your arm, on the other side of your arm, on the same line of the grid, I'm going to take a Q-tip that doesn't have any allergen on it at all, and I'm going to just rub it right there. And what that does is it just ensures that any reaction you have is to the allergen itself and not to any other variable. So nothing like if the Q-tip itself is bothering you or any friction from the rubbing. Does that make sense? Okay, perfect. So similarly, to ensure that any reaction you have or any abnormality we see on your skin is truly a result of just the allergen, we need to do a quick little exam of your skin and make sure we don't see any sort of abnormalities before we put the allergen on. Okay? All right, so I'm going to go ahead and get out my pen light, and I'm just going to get a little bit up close to you. Yeah, you don't have to look at the light. I'm just examining the skin on your face. Good. You can look at the light if you want to, but you don't have to. This is not an eye exam. This is just a very, very quick exam of the skin on your face. Okay, and I don't see anything. I don't see any abnormalities. Do you have any skin conditions that you know of? No? Okay, perfect. So next I am going to examine the skin on your forearms, okay? So if you can go ahead and hold out your arms, and I do see that you have long sleeves on, so I'm going to go ahead and roll those up if that's okay. Okay, perfect. And good. Okay, and the other side. Good, okay. So arms out. Good, I don't see any abnormalities, but I'm going to go ahead and take a quick peek with my pen light. That arm appears to be good, and okay, that arm appears to be good as well. Before we get started with our allergy test, I am going to need to sanitize both of your arms. And before I do that, I'm going to sanitize both of my hands. So I have some hand sanitizer here. Hand hygiene is very important. Okay, so go ahead and hold your arms back out, please. Thank you. And I'm going to go ahead and sanitize them. I have some sanitizer wipes here. Okay. All right, left arm, please. Thank you. Good. 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 Okay. And I'll get another one. All right. And other arm. Thank you. Okay, those arms are looking nice and sanitized, but before I draw the grid on your arms, I actually need to ensure that they are completely dry and none of the alcohol that we just wiped on them is gonna mess up the marker. So what I am going to do is I am actually going to bring out this little fan. And I'm just going to just dry them off really quick, okay? All right, this arm, please. Thank you. Good, 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 good. And the other arm. Okay, good job. And now we can go ahead and draw our grid. So I have a marker here. And this arm, please. Thank you. We'll go ahead and draw that grid. Perfect. And the other arm. Okay. Good, 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 good. Okay. All right, and same thing, before I apply any allergens, I gotta make sure the ink from that marker is dry. So I'm gonna pull out my handy dandy fan one more time. All right, and this arm, thank you. Okay, and this arm. All right, great job. All right, my friend. So the first allergen that we're going to be testing is latex. Latex. Do you have a latex allergy that you know of? No? Okay, perfect. So I'm going to pull out a latex glove, and I'm going to be putting on just one for right now. Okay, and I'm going to be rubbing the first square with my finger that has the latex glove on it. So go ahead and hand me your left arm, please. Thank you. Okay, and ready? Okay, good, 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 good. And now, like we said, I need to do the control side. So I'm going to be rubbing the other side of the grid with my finger that does not have a latex glove on it, okay? All right, perfect. So hold out your arm. Thank you. And ready? Perfect. Okay. So the reason we did that first is because I need to see if you have a reaction to latex, and if you do not, then I'm going to go ahead and keep latex gloves on for the rest of the exam. And if you do, then I would have to take it off and I'd have to get some non-latex ones. Okay. All right, perfect. So yep, go ahead and show me your arm. Thank you. And I am not seeing any reaction to latex. That is great. So I will go ahead and put on my second glove so we can move on with the rest of the exam. All right, so we'll go ahead and continue and move right on down your left arm first. We're going to do the entirety of the left arm, and then we will move on to doing the right arm. Okay? All right. And I'm going to apply the remaining allergens with Q-tips. Okay? So I'm going to be spraying a little bit of the allergen on one end of the Q-tip, and the other end of the Q-tip is not going to have any allergen on it, and I'm going to put it on the control side, okay? So, our next allergen is pollen. So I'm going to take my Q-tip and I'm going to spray it with a little bit of the allergen pollen. All right, and this arm, thank you very much. Okay, good. And now we're going to do the control side, okay? Ready? Okay, good. All right, moving right along, our next allergen is cats. All right, I have my next Q-tip here. All right, same arm, please. Thank you very much. Ready? Okay, good job. And gonna do the control side, okay? Ready? All right, good job. Moving on to our next allergen, which is dust mites. Okay. All right, still this arm, thank you very much. Okay, good job. And now for the control side. Okay. Good. Okay, perfect. And moving on to our next allergen, which is peanuts. All right, still this arm, thank you. All right, and time for the control. Okay, perfect. And last one on this side, our next allergen is dairy. Okay? And the control side. Okay, perfect. So now we're halfway through our allergens and we need to switch over to the other side, okay? All right, perfect. So go ahead and hold out your right arm. And the first allergen that we're going to test on this side is perfume. Okay. All right, this arm, please. Thank you. Okay, and the control. All right, good job, good job, good job. Our next allergen is grass. It is grass. All right, right arm, please. All right, and the control side. Okay, good job. Moving on to our next one, which is dogs. Dogs. All right. Okay, and the control. Okay. Next one is mold. Mold. Okay. Right. All right. This arm. Thank you so much. And the control. All right, we're almost there. We have 2 left to go, 2 left. Our next one is shellfish. Shellfish. All right, this arm, thank you. Okay, and the control. Okay, and our last one is wheat. Okay. Okay, and this arm. Thank you so much. Okay, and our final control. Great job. All right, my friend. So now that those allergens have had a few minutes to sit on your skin, we're gonna go ahead and do another quick exam to see which allergens you've had reactions to, okay? All right, perfect. So hold out both your arms, and I'm gonna bring out my light again. All right, and okay. Yeah, I definitely see some reactions. Okay, and checking this side. Okay. Alright, so you're definitely allergic to grass and pollen. Those are the two that had definitive reactions. And there are a couple more that have inconclusive results. You show a very, 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 very slight reaction to both shellfish and cats. And when we have a reaction that is that slight to the usual test on your skin, we can actually do something called an intradermal allergy test. And what that means is we take a tiny little bit of the allergen and we put it under the top layer of your skin, and that will give us a better indication of whether you are truly allergic to that allergen. Yeah, unfortunately we do it with needles, but it's just teeny tiny. I promise it does not hurt. Okay, so what we're gonna do, we're gonna use the skin that's a little higher up on your arm, okay? Not the forearm. We're gonna come up here this time, okay? So I do need to roll your sleeves up just a little bit more, okay? Alright, thank you. Good, and this side. Good, okay. So we only need to do it for the two that had slight reactions, for the cats and the shellfish. So I'm gonna go ahead and I'm gonna get a sterile needle here, and I'm gonna go ahead and put the allergen for cats on here. Okay, and now just a very teeny tiny little. Okay, see, that was it. Didn't even hurt. And we're gonna do the other one for shellfish. So again, I have a sterile needle here, and I have the allergen for shellfish. Okay, and on the other side, just a teeny tiny little. Okay, perfect. Okay, so we're gonna give the intradermal test just a few minutes for any reactions to show up. And while we do that, I am going to take some aloe and I'm going to rub down the areas on your forearms just for comfort, just to soothe the skin, because we put it through a lot with those allergens. Yeah, okay. So I have some aloe here, and we're gonna go ahead and get a healthy amount. Alright, and this arm first, please. Thank you. Good. Just going up and down your arm. And how does that feel? Soothing? Good. We want your skin to leave here happy today. Okay, and we're gonna do the other side. So get some more. Alright, and this arm please. Thank you. So how was your first allergy test today? Not too bad. Your skin doesn't look too bad. Even the reactions that you did have weren't too severe. Okay. Alright, well, your forearms are looking happier than they were a few minutes ago. I'll take these off. And that should be enough time for us to check back on our intradermal test. Okay, so I am not seeing a reaction on this side. That is great. And Okay, I'm not seeing a reaction on this side either. That is great. That means you are not allergic to cats or to shellfish. The only things that you had a positive reaction to today were grass and pollen. So those are some pretty common seasonal allergies. Yeah, so I would just recommend that you take some over-the-counter seasonal allergy medication if it's bothering you. Okay, perfect. Well, do you have any other questions for me? No? Okay. I hope you enjoyed your allergy test today. And as always, good night, my friend.